Hi, everybody. It's Patricia Coughlin. I guess it's been about 3 weeks since my last video. I'm busy, as you can imagine, finishing everything up this year for my clinical practice and simultaneously doing things to launch my art career. But in any case, I do want to respond to the questions and suggestions that people have made about things that they really want to hear about before this channel ends at the end of the year. And one of those, why don't we start at the beginning, right? One of those was about the trial therapy, understanding what it actually is and why it's important. So let's put this in context. Most therapists start when they first see a patient with the past, looking at history and taking a history basically, and maybe only giving themselves 50 minutes. If you think about it, people are never more anxious but eager than when they first come to see you. The average patient waits a year between the onset of their distress and calling for help. So you might want to think about extending the time that you have with the patient in that initial consultation so that you have time to test out. I'm going to get into this. It's why it's called a trial therapy, because we're doing a trial. We are using the experimental method of gathering data, forming hypotheses, testing them out to discover what is the underlying nature of the problems the patient is describing. So we know actually that history, developmental history, and descriptive diagnoses like the DSM-V or whatever it is at this point are not at all prognostic. So that means that you can get that information, you can form those kinds of diagnoses, generalized anxiety and an obsessional personality. And it's not going to tell you anything really, either about the source of those problems or what kind of treatment is likely to be helpful. We have known since the 60s, starting with Dr. David Malin and Michael Balint at Tavistock, again, that really the only thing that accurately predicts whether a person is going to be able to respond to the therapy you're providing is to actually expose the person to all of the essential elements of that therapy and to track their response to intervention. And so it's trying out these different interventions and seeing how the person responds in real time. That's what's going to tell you whether they can engage in the kind of therapy that you're offering or not. So, and when Malin and Balint were first doing this work at the Tavistock, they were still practicing quite traditional psychodynamic psychotherapy. So the only real trial that they did was a trial interpretation. They would listen to the patient's material, try to detect patterns, and see if they could identify the current problem as the most recent iteration of a repetitive difficulty that had its origins in the past. And if the therapist was able to do that, and they could communicate it to the patient, and the patient was able to have an emotionally significant response to that interpretation between the unresolved past and the current suffering, then it boded very well for the patient to be able to use short-term dynamic psychotherapy in a therapeutic manner. Now, Dav and Lou really expanded upon traditional dynamic psychotherapy, took a much more active approach, identified and confronted defenses getting in the way right from the start, also dealt with feelings coming up toward the therapist in the transference from the first sign of them. So there are many stages in ISTDP, Davenlou's method, that we are going to test out and track the patient's response to. So Davenlou created what he called the central dynamic sequence, and this was a structure for intervening, certainly in the first session, often in subsequent sessions as well. And this becomes sort of the guide, the framework for your trial therapy. So we're always going to start with an inquiry. What seems to be the problem? And we're looking for the problems right now. What is troubling the patient? What is giving them pain and suffering right in the here and now, because that is where their motivation lies. So we're going to start with this investigation of the nature, the history, and the severity of these presenting problems. And then we're going to look for a recent example so that we can then put the patient on from the triangle of conflict and assess their capacity to work in a focused and dynamic way. So if they have problems with self-assertion and they're letting themselves get run over all the time, you're going to look at a recent example of that. Maybe it was with the boss or a roommate. And so you're somewhere on the triangle of person there, someone in their current life, and then you're going to find out what the situation was. I'm thinking of a young woman who was having trouble with her roommates, and she was externalizing a lot that they were the problem. They played loud music, they ate her food out of the refrigerator, on and on. And so I had to say, okay, it sounds like you're talking about some problems that your roommates have, but you're the one who's here, and you're struggling in some way in dealing with your roommates. Is that right? Yes. So could we look at this recent example, right, with the music, it turned out, and let's look at what kinds of feelings you're having toward your roommates, right? Can the patient identify the feelings they're having toward others, right? Or do they just talk about themselves? Well, I guess I'm being too picky. Maybe I shouldn't get after them about that. Well, that's not a feeling toward them, right? So you're going to start to see defenses coming up, and then you're going to see anxiety as you press for and you point out that's something about you that's not a feeling toward them. They're going to get anxious, right, as you press them to look at the feelings they tend to avoid, and you're going to evaluate this. So I'm probably going to have to do a couple of videos on this because it really is complex and there are many stages to this evaluation. But again, you're going to see right from the start whether the patient is able to cooperate with you, give you the information you're looking for, or do they just stay vague and you can't really get any sense of what's going on? Or do they stay external? Well, I'm here because, my mother told me I had to, or she wasn't going to pay for college anymore, or whatever it might be, right? Can they engage? Do they have an internal focus? Can they talk about the problems they're having, or just continue to externalize? So all of the patient's responses to your attempts to get this internal focus on the presenting problems is going to give you a lot of information about who this patient is right now, what their capacities are, what their strengths are that they're bringing to bear, and what their difficulties are both in engaging with you and the parallel in their life. So again, I think I'll cut this up into several components, and we'll continue to talk about how to do this trial therapy, obtaining the most timely and accurate information, helping you both to accurately diagnose the person and to see how they're able to respond to your treatment or whether some other form of treatment is actually going to be indicated. And again, in order to be able to do this, you're going to have to schedule patients for 2 to 3 hours for this initial consultation. And you should know that there is research not only from the ISTDP camp, but the psychotherapy research literature in general suggests quite clearly that the more time you spend in that initial contact, the better the chances you have of understanding the patient, engaging them in treatment, and getting off to a really strong start that bodes well for positive outcome in psychotherapy. So I hope this is a helpful start on this topic, and we'll talk more about it in the next couple of videos. Thanks. Bye-bye.